Hi, today in Biochemistry Bits, we are seeing the case-based biochemistry discussion series, episode 9. So the initial case presentation is as follows. We have a 9-year-old child with history of presenting illness, recurrent abdominal pain, tingling sensation in the lower limbs, and family history of similar findings in a sibling. And on examination, there was a different peculiar finding. The tonsils were enlarged and characteristically yellow-orange in color. It was noted since early childhood. And that is what is depicted in the image here. Yellow-orange colored tonsils. This is a very characteristic feature of this disease. And on abdominal examination, there was mild hepatosplenomegaly. Neurological examination showed decreased peripheral sensations. So with this clinical background, we went into the investigations where lipid profile was ordered and total cholesterol was much below the reference range, 85 milligrams per deciliter with a reference less than 200 milligrams per deciliter. HDL cholesterol was very low. We have a reference of 40 to 60 and the patient had a value of less than 5 milligram per deciliter. LDL cholesterol was also low, 50 milligram with a reference of less than 100 milligram per deciliter, and triglycerides was slightly high. Reference less than 150 milligram per deciliter. The patient had a value of 220 milligram per deciliter. ApoA1 levels were then checked and which was markedly reduced from the normal reference range. So with this clinical presentation and the clinical investigations profile, we come at the diagnosis of Tangier disease. So what is Tangier disease? It is a disease where there is a mutation in the ABCA1 gene. What is this ABCA1 gene? It is a ATP binding cassette transporter A1. So there is a defect or mutation in the ABCA1 gene, and that ABCA1 gene codes for a transporter, which is this ABCA1, that also becomes defective. And the inheritance pattern is autosomal recessive, and that is why in our case scenario, we had a strong family history as well. So let us see what does that protein ABCA1 transporter do. This is the left side of the image shows what is the normal function or the healthy physiology. So in the macrophages, the functional ABCA1 transporter helps in the efflux of free cholesterol and phospholipids. And this binds to poor lipidated particles like ApoA1 and helps in the formation of nascent HDL. Now this HDL gets mature and gets transported to the cholesterol transports all the cholesterol to the liver for excretion. This is the reverse cholesterol transport which normally happens. What happens in Tangier's disease? The ABCA1 transporter gets mutated. So what happens? The cholesterol efflux is blocked. So ApoA1 cannot bind the lipids. ApoA1 gets degraded. And as a result, there is severely impaired nascent HDL formation. As a result, our HDL levels become low and also our ApoA1 levels are also low. So this failure of the reverse cholesterol transport will cause massive accumulation of cholesterol esters within the macrophages, and that is a reason for the entire range of clinical manifestations. The infiltration of that cholesterol esters within the tonsils, that is why we had the enlarged yellow-orange tonsils. Then we have the infiltration of the liver, spleen and lymph nodes, and that is a reason for hepatosplenomegaly and abdominal pain. And also we have the infiltration of these cholesterol esters accumulation in the nervous system, which presents with peripheral neuropathy as described with the tingling and decreased peripheral senses in our patient. So just to summarize, Tangier disease is a disease where you have abnormally very low HDL levels, and it happens because of the mutation of ABCA1 transporter gene. So as a result, cholesterol transport or the reverse cholesterol transport does not happen and all the cholesterol esters accumulate, and the characteristic finding in Tangier disease is enlarged yellow colored tonsils.